A Vision for Addiction Treatment and the Use of Brainwaves as a Tool in Assessment with Dr. Tonmoy Sharma, Chief Executive Officer for the Sovereign Health Group, and Dr. Judy Ho, PhD in Clinical Psychology and contributor for CNN, CBS, ESPN, and HLN.
We've talked about the assessment. In the brief period that they're actually in treatment in one of your centers, what can you do for them if we find that there are significant cognitive impairments? What are some things to give them right away while you have them in your center?
Well, they participate in our brain wellness program, in our brain wellness classes. They have cognitive remediation that is done. Neurobic is one of the programs that we have. It's online. They do that. They also have a structured program that they go through for 8 to 12 weeks, and they're right from nutrition to taking care of sleep. Everything that has an effect on the brain, they're taught about this. Remember that young people, and we mostly get the younger population, they have led extremely chaotic lives. You've got to bring them back into a lifestyle that's going to be much more organized, and you've got to talk to them about why brain function is important, and that they still have a brain that can reverse the damage. They can have the neurons reversed. When I was in med school, we were told that the liver and the skin are the only organs that can regenerate. And obviously, my teachers were wrong.
Yeah.
And we know today that neurons can regenerate themselves. So it's important now to say, well, okay, you've caused this damage for whatever reason. However, it's now possible to do whatever remediation is required. People make mistakes.
That's right. Yeah. And that's a really hopeful message, I think, that there is neuroplasticity at every age and that there's certain things you can do to help that along. And whether or not they got that injury through substance use or a traumatic brain injury, there's a solution, which is wonderful.